It is estimated that up to 1 out of every 4 infants will develop colic, but you may not give that much thought until that infant is your baby. Suddenly, it becomes important to know what exactly is colic, what may be causing it, how long does it typically last, and perhaps most importantly, what are the techniques you can use when the crying just won't stop? Who am I? I'm a board-certified family physician with 33 years experience treating patients of all ages. I'm also a mother and a grandmother, with my youngest grandchild having been a colicky baby. So I understand the frustration of not being able to soothe your crying baby despite your very best efforts. And that does not mean that you're doing anything wrong. But let's discuss colic to see if there's something you might not have known that could help. So what is colic? Colic is sometimes described as a diagnosis of threes because it is defined as crying 3 or more hours per day, 3 or more days per week, for 3 or more weeks with no apparent underlying cause. It usually starts at about 3 weeks of life, although it can be as early as 3 days. Typically, it resolves by 3 to 4 months of life. The cry of colic is often higher pitched than the baby's typical cry, sounding more like a screech and often associated with a stiffening of the body or an arching of the back. The crying is often worse in the evening, a time that parents commonly refer to as the witching hour. So what are the first steps to take when your baby begins a high-pitched, insistent-sounding cry? First is to check their fingers and toes to be sure that a hair is not wrapped around one, a condition we call a hair tourniquet. Next is to check for other conditions that may be causing discomfort, such as hunger, a wet diaper, uncomfortable clothing, or feeling too hot or too cold. Maybe they have gas and need to be burped. Check for signs of illness, such as a fever or congestion. If any of these conditions are present, they need to be addressed, but the crying associated with them would not be colic. If crying continues despite ruling out the acute causes of discomfort, then it is time to check for chronic conditions that can mimic the symptoms of colic. First is reflux. We all have a muscle between our stomach and esophagus called the lower esophageal sphincter, or LES. The LES closes like a purse string to keep the contents of the stomach from rising back into the esophagus. Sometimes, though, it doesn't close tightly enough, and the milk and stomach acid rise back up into the esophagus, irritating it. Sometimes it's just the stomach acid vapor escaping and causing the irritation. If your baby has reflux, it can cause symptoms similar to colic. However, it is not the same as colic since colic has no discernible physical cause. Reflux needs to be diagnosed and treated under the guidance of your doctor. It is a big enough topic to warrant a separate video. Let me know in the comments if that's something you'd be interested in. Another condition that can mimic the irritability of colic is pyloric stenosis. The body has another purse string muscle between the stomach and the duodenum. That muscle can be too large and thick, making it difficult for the milk to leave the stomach and enter the small intestine. In addition to causing irritability and crying, pyloric stenosis can cause projectile vomiting and a mass in the upper abdomen that feels like an olive. This is also a condition that your baby's doctor can diagnose, and treatment is a surgery to open the sphincter. Another condition that can mimic colic is an inguinal hernia. Although both girls and boys can be born with inguinal hernias, it is far more common in boys than girls. It is also more common in premature babies. This is also a big topic, but for this video, it's worth knowing that inguinal hernias present as a bulge in the groin or scrotum that typically gets bigger with crying. It is also treated surgically. So if your baby is irritable and has a bulge in the groin or scrotum, have your baby's doctor check for possible hernia. Another chronic condition to rule out before saying your baby has colic is milk intolerance. This could either be a cow's milk protein allergy or a lactose intolerance. Again, these are conditions for your baby's doctor to diagnose and treat. I don't recommend changing your baby's diet without the guidance of their physician, but these are conditions to rule out if your baby appears colicky. One last chronic condition to check for in a baby with possible colic is a tongue tie. There's a small piece of tissue that connects your baby's tongue to the bottom of their mouth, called the lingual frenulum. In some babies, the frenulum is too short, a condition known as a tongue tie. If your baby has a tongue tie, it makes it difficult to feed, so this can contribute to irritability. This can be corrected by a procedure in which the frenulum is cut, releasing the tongue for better feeding. If your baby's tongue can't extend beyond their lower lip, they may have a tongue tie. Be sure to have your baby's doctor check for this. So if your baby does not have any underlying physical conditions causing discomfort, yet still cries 3 or more hours per day, 3 or more days per week, for 3 or more weeks, they're considered to have colic. And what treatments can help with this? First is to take a deep breath and try to calm yourself. Speaking to your baby in low, soothing tones will always help more than becoming upset. Once your own emotions are under control, you can try some of the techniques that have helped other colicky babies. But every baby is different, and if it doesn't help your infant, that does not mean that you're doing something wrong. But here are 7 techniques that you can try to see if they'll help your colicky baby. Number 1, swaddling or skin-to-skin contact can help calm a colicky baby. Similarly, some babies improve if you wear them in a front carrier. Number 2, swaying or dancing with your baby sometimes helps and can improve your mood as well. Number 3, sucking on a pacifier or a clean finger. Number 4, taking your baby for a car ride. Number 5, giving your baby a warm bath. For some babies, even the sound of the running bath water soothes them. Number 6, vibrating chairs can make a big difference. If owning one is outside of your budget, putting your baby in a carrier on top of a clothes dryer on the spin cycle can also work. Of course, you have to have your hands on the carrier the entire time to keep it from vibrating off the top of the dryer. Additionally, you don't want to keep them in the carrier or a vibrating chair for more than 20 minutes in order to protect their airways. You should also always observe them for safety during any of these settling treatments. Number 7, white noise. For some babies, a white noise machine can really help. If you don't have one, sometimes the noise from running a vacuum can work. Making repeated shushing sounds can also be beneficial. What about over-the-counter medications? Number 1, gripe water. Many people ask about gripe water, but this is just a term manufacturers use for a combination of herbs and other ingredients. It is not FDA regulated, and the ingredients vary from manufacturer to manufacturer, so I don't recommend it. Number 2, simethicone. Infant simethicone drops, such as infant Mylicon, can help with crying from gas by helping to reduce the gas. However, if the cause of the crying is gas, then you're treating infant gassiness, not colic. Number 3, probiotics. Some studies have shown that probiotics such as Lactobacillus reuteri can help with infantile colic. If you're interested in trying this for your baby, talk with your baby's doctor to get the correct probiotic composition and dosage for your infant. Don't just take a guess. And what about infant massage or chiropractic treatments? Although gentle infant massage can be soothing, I don't recommend chiropractic adjustments in infants. Their bodies are very delicate, and I would not want to risk any potential harm from spinal manipulation. In addition to trying gentle massage at home, you can try bicycling your infant's legs to see if that helps relax their body. Finally, keep in mind that colic typically resolves by age 3 to 4 months. Babies are fragile, so never ever shake a baby, as that could result in brain damage or even death. If you feel yourself close to losing control, put your baby safely in his or her crib, step out of the room, and call for help. Taking care of babies is hard, and colicky babies can be especially difficult, but every moment you devote to them will be worth it as they grow and change, knowing that they are always loved. If you found value in this video, you may also like the other videos in my parenting tips playlist or my playlist on the most precious gifts you can give your children. And if you know someone that might benefit from this video, please share it with them.